Great. Well, welcome. Good morning. And not a lot to announce this morning on things going on, but let's just go ahead and get started. Jeremy, you have anything to say?
No, I don't. I guess we can now take it to Stephen.
There you go. You got to unmute, Stephen.
Great. Okay. Good morning, everybody. Just a couple of quick pieces of update before we turn over to the current working group. First, as you all know, prior to our last meeting, we received the letter from Judge Hidalgo, and we have drafted a response at this point, not submitted it because we're really in communication with the judge's office and want to sort of talk about some things. So I think we will probably be in a position to finalize that and report back at the next one. Similarly, we are in conversations with, and Jeff, I think, will update folks on this and his, but we're in conversations with the city and the county on some of the work that we've previously conceptualized. The last piece that I just want to mention, as we're really trying to think through during this, what I would call quiet time while the moratorium, the CDC moratorium is in effect, I think we're really struggling with wanting to understand better some of the data around what's really going on. Some of you may have heard the segment that NPR did, the local NPR affiliate did, I think earlier this week, on the situation, both in terms of sort of self-evictions that are going on, illegal evictions that are going on, the issue of really, I think, trying to pull together a better understanding of what is happening now in order to be able to inform and help us think about what we really need to be anticipating will happen when the moratorium is open. So both responding to the current situation and using the current situation to try to anticipate what is going to be, what we're going to be facing, I think is something. And I think not just our own local situation, but as I've talked to folks working in other parts of the country, it's also something that others are really challenged by. So I think we'll need to continue to do some of that. And I think pursuant to that, one of the things that I think we want to try to do is invite organizations that are a part of the membership of the task force and or know others to think about presenting what they're seeing on the ground in future task force meetings. So to the extent that anybody that's currently on might be interested in doing that, if you'll let us know, and we'll make sure to schedule time appropriately for some of our future meetings and potentially special meetings as well. So with that, let me turn it over to Elaine, Martha, and Jeff, who are going to kind of give an overview and update on the current work.
Good morning, everyone. I want to take just a minute to really thank the Rent Assistance Work Group members. They have been quite persistent and persevering. We've met every other week during the fall, and we've learned a tremendous amount about what is happening with rent assistance programs in Houston. We have considered some new ones as well, so they really all get a standing ovation from me. I appreciate their work. The next slide, Elaine. So we continue to build our shared knowledge, and last week we heard from Sharon Zachary at ACAM, the Alliance of Community Assistance Ministries, and I submitted a typo in this slide. I apologize. their average reported rent decrease in their eviction prevention program is actually 10%, not 1. It's very early into the program. What they are doing is working with tenants and landlords after a notice of eviction, and notice to vacate has been issued. And they are having some negotiation conversations with landlords, which has proved to be helpful as much as we know to date. We also heard from Akeem Jamouyan at the Texas Policy Lab, where he and his team have put together a process to conduct a rent assistance auction, which would be directed at landlords, asking them to let an agency know what their rate for preventing eviction for a certain tenant might be. And because of some questions that we had in that work group, there were some aggressive questions around fair housing, around where the model is most suitable, how do you target that, and providers. With a number of questions, we're really going to pilot this at a time that's a little bit more optimal out in the field. But it's still under live consideration. We will be this week, the group asked for a rent assistance map, including funding streams, and that's being worked up now. We hope to have at least a draft by next Friday. And we're also working on our recommendations to Judge Hidalgo. Jeff, you have some things you'd like to say?
I do. Thank you, Martha. So just like Martha started, here is the Access to Justice Work Group. And again, we've got both task force members and some non-task force members on. And again, like we designed all these work groups, really making sure that we had good representation from community organizations, from landlords, and from tenants. So next slide, please. An update of where we are and what we've been doing. So on our tenant landlord facilitation pilot update, as we reported last time, we did receive a grant from the COVID fund, and we have determined our rental assistance agencies. And we really wanted to find the agencies that not only had, good experience in delivering rental assistance, but were part of networks that if this is successful, we can possibly move this concept into different organizations. Again, we heard all along that the best intervention happens up front, but many organizations don't start the intervention until the notice to vacate is received. So we're really trying to change practice on how we do our work. And we've got MAM, Memorial Assistance Ministries, and they're one of the, I'd say, top financial assistance organizations in the city, both in ongoing crises for families and disaster. They're part of ACAM and the United Way Thrive Network. Wesley, a multi-service organization serving the North Side, really a part of the networks, both ACAM, LISC, Financial Opportunities, and United Way Thrive. And then Alliance, which really focuses on refugees and immigration, but they've also developing their capacity around housing counseling. And that was one of the things we were looking for in our spectrum of services. We wanted to make sure that if an individual was not in an appropriate apartment, that there was some support for them to find their next step. We are waiting on our pilot evaluation proposal from the Texas Policy Lab, and we hope to see that soon. On our web portal, I'm very excited that Connective volunteered to hold some focus groups. And what they're doing is developing a quick scale prototype in Spanish that is around the CDC moratorium, and then testing that on focus groups. And that's going to be happening next week, right? So when we're ready to kick off this project, we'll already have a body of knowledge to work from. And the Connective model, I think, is really interesting because they like to prototype early on, a rough and ready design, getting the feedback from users, and then making sure that feedback is integrated into everything that goes forward. So instead of going for the finished product and then getting feedback, really making sure you get the feedback up front. And they're doing it in Spanish because they believe that designing for folks at the margins really results in better design for everyone in the end. So I'm excited that's happening. And we've heard from Janae and Sophie in Commissioner Ellis' office with some questions they had about our proposal. So we'll be getting that information to them, I'm sure, sometime next week. So we think there may be some funding potentials out there. Finally, I've been working with the Housing and Community Development Department, making sure that we're getting information out, moratorium information out there, especially through the nonprofit networks that I know that I'm involved in. And just like the rental assistance work group, we'll be looking at, from the things we learned about our key projects, the portal and the facilitation products, the facilitation project, we will be thinking about overall recommendations that will be coming out of this work. And that's my update. Thanks.
Curtis, are you on mute?
Oh, yeah, he
Oh,
is.
Curtis is on mute. You're on mute, Curtis.
Unmute. Okay.
There you
Oh,
go.
there you go.
Thank you. Good morning. We had our initial meeting with the Landlord and Property Stabilization Work Group last week. Earlier this week, there were more people invited than what's on this list. Can you go to the next slide, please? And one of the goals of the meeting for the overall initiative was to create a model of optimal program design for landlord support, and not just landlord, it's the landlord and the property. And part of the effort in doing that is understanding who those landlords are. The focus was really, there was a consensus about this focus being on small to medium-sized landlords, and a need to really build a common knowledge and understanding of this. And what is clear is that visibility into this group is very, very shallow. The data is very dispersed, and the belief is that roughly 50% of the affordable housing units falls with landlords who own 50 units or less. The potential initiatives that we did not discuss last week, we really were focusing on defining the landlord. And in our next meeting, we will begin to get into the potential initiatives, are determining innovative financing solutions if they're necessary, landlord on local government programs for temporary relief housing. And again, this is something that we would want to coordinate with the other work groups, because there's similar kinds of efforts going on. And I think understanding the problem from the landlord's point of view is the initial effort before and seeing how that problem is addressed in the initiatives that are being led by the other groups. The naturally occurring affordable housing preservation again would be something that looks at mechanisms that assure that whatever support is given, it provides, it maintains existing affordable housing. And then this notion of a registry or some kind of inventory of this housing that to date has been very invisible in terms of our ability to understand exactly what's going on. Next slide, please. In terms of the actual meeting, some of the first thing that we really focused on was this question of defining who a small to medium landlord is. And this notion of how many units constitute a small landlord has a number of dimensions of definition. One dimension is the actual number of apartment units. The industry uses the terms doors. I know when I was doing hotels, we used the term keys. And most of us are used to the term units. But I think this for now, we're going to be using the term doors because that's a term that the industry is familiar with. And this question of that switch from being self-managed to professionally managed, either because the landlord decides to take this on as a full-time job or hires or contracts those services, that decision begins to be considered at the 30 to 120 door level. And that has different implications in terms of the lending that they would seek out. And it has implications in terms of the sophistication of the financing and management of it. At 120 units to 1,000 doors, that really is a professional landlord activity, even if the landlord is an investor and hires out that service. And then the 1,000 to 2,000 doors is typically a corporate landlord level. The cutoff for service and who we want to focus on is really that 120 to 1,000 door level, or it may even fall to that 30 to 120 door level, depending on how we, what kind of information we can get back as we do our research. The issue of financing for this is something that, again, we wanted to get some better answers on. There was some good conversation about whether or not community banks versus institutional banks are a better source of information over time for determining what is actually going on with the landlord community, who is at risk. That question of the property being part of one's personal finances and the impact that COVID-19 has on your personal finances versus it being a separate entity that you benefit from is a big question to clarify. There are other sources of information that we're going to be gleaning, and we'll come back to report back to the group next week. The goal is that by the early November, we will have made a clear determination of the dimensions of the problems. We'll certainly be participating in some focus group. Connective has offered some support in that regard, and be able to begin to talk about what makes sense programmatically that could be put in place in the new year. I think my gut tells me right now, from what I'm hearing and what I'm seeing and the work that the other groups are doing, is that the first order of business is to see how we dovetail with the work of the initiatives of those other groups, and how that can impact or mitigate some of the problems that we discover that the small landlords are experiencing. And that the second order of business would be programmatic. That's kind of what I see. But the larger question of knowing what's going on is a separate initiative in and of itself, to really begin to understand who that population is, where that population is, and how can we get visibility into that population. That's about it. We will have another meeting scheduled in the next week and a half. We haven't set that meeting time yet. We had a provisional date established, but we need to come back and confirm with those who were unable to attend the meeting that we had earlier in the week. Right. Elaine or
yep, Elaine.
Stephen?
Go ahead, Elaine.
Okay, hi everyone. So as all the working groups prepare overall recommendations on the next few months, we also want to influence or bring in policy recommendations as we had on our initial goals. So we want to provide a set of policy recommendations to the county in mid-November, so they can be considered either locally or for the state. And the process will be that we are doing some research on best practices nationally on policies and programs that have been passed and implemented in other jurisdictions to address housing stability. And we will convene a group to review this research and prioritize the top policies that will inform our overall policy recommendations. So many of you will reach out to you, and if you're interested in participating in this process, please let us know. And then, as you know, this is what we're looking forward for the next 3 months. We will continue to respond to the government requests. As Stephen shared, we are in conversations with the county about the recent request from the judge about regular reports from the task force as to inform COVID response as it relates to housing stability, as well as what the county should do after the moratorium or CDC order ends by December. We'll continue the work of the working groups until the end of November, and then have overall recommendations and continue our meetings and presentations. It would be great if you let us know of a specific topic or presenter you want us to bring to the task force. And as you all know, we'll have bi-weekly updates up on our website every 2 weeks. I think we're moving on with Jeff, Stephen.
No, I think we're going to have Jeremy and Donna talk a little bit about the new state eviction diversion program, and then we'll move to Jeff.
Donna, you can go first.
Thank you, Judge. I'm glad to share the few details that we have, at least initially. We are kind of getting breaking news as it unfolds. There's an emergency order that came out of the Texas Supreme Court, I want to say about 10 days ago, Emergency Order 27. And we also got an order from the governor's office setting aside some $171 million for rent relief, along with $4.2 million for legal services. As far as I'm aware, there are a number of members of the Eviction Defense Coalition who have received funding as legal service providers to assist tenants who are going through eviction and who will be eligible for the eviction diversion program. My understanding is that Harris County is one of the very few counties that's been selected for the pilot program. That pilot program launches this Monday, October 12th in Harris County. And among other things, and I'm happy to hear from Judge Brown, I think you'll know way better than I do. I have this information from the county that the justices of the peace will be asked to notify both parties, landlords and tenants, that this program exists. The hope and the goal is to encourage the parties to contemplate this program and enter it. If a tenant qualifies, and that is at or below 200% poverty or 80% area median income, households that have been financially affected by COVID, and tenants who are not presently receiving tenant-based voucher assistance or living in project-based public housing, as well as landlords under certain criteria. If the two parties come together and agree, the relief that's being provided by the state is really significant. It's up to 6 months of back rent. Landlords do need to agree that they will waive late fees, penalties, and they will not pass court costs over to the tenant. But the benefits here are significant. To the extent that Lone Star Legal Aid is involved and has been assigned the legal service provider, I believe that the state has, Jeremy, Judge Brown, let me know if I'm misstating this. Our phone numbers, the legal service providers will be on citation starting Monday so that tenants can reach out. We will be facilitating and helping tenants complete applications. We haven't seen those applications yet. We're waiting for them any minute now. We want to be able to help tenants complete that process, hopefully get word from the courts and the clerks to the landlords that these funds are available and that they're significant, and hopefully really be able to help the population divert evictions. I don't know that I have a whole lot more to add at the moment, so I'll turn it over. But if there are any questions, I'm happy to try to field as many of them as I can.
So, and from the court's perspective, this is separate and apart from the CDC affidavit. So if a tenant fills out a CDC affidavit, we automatically abate the case and say the case is January 1, right? This is just another step in the process. So on our citations, it's going to be the CDC information about the CDC order and information about this pilot program. Specific to Harris County, the initial money that's available for rental assistance is $500,000, and the administrator of the money is Gulf Coast Community Services Association. Phase 1, again, as Donna alluded to, is next week, the pilot phase. Then the next phase will be all the counties. And that's that, the breadth of the $171 million. But that is countywide. That is statewide. That is CARES Act money and other federal funding that is already available. And to Guadalupe's question about immigration status, quite frankly, because it's from our good Republican and conservative friends, that's going to be an issue. And the requirements that are already there for other federal funding will be for this particular funding as well. That is about it on that end. But I guess the other part and significant part about this program, that the Texas Supreme Court has given the individual JP's discretion that if people participate in this program, then we can abate the case for 60 days. If the landlord does not reinstate the case, then we will dismiss the case with prejudice, plus seal the eviction filing, right? And so an issue that we've had previously with evictions is that regardless if somebody has paid the back rent, that eviction filings is on their record. But the Texas Supreme Court, but this is only COVID related, it has to be COVID related, will allow the individual JP to seal the filing of the eviction if the case is not reinstated within 60 days.
And I'll just add that I think that may be one of the greatest protections that we've seen for tenants so far in the pandemic. I have been curious, and I think it would be worthwhile to invite Howard Bookstaff. I think I had seen him in the participant list. I'm very curious to know if the TAA not only was involved in drafting some of this, but if they've blessed it. And certainly I would be curious to hear if they have any input from the TAA on this diversion program. My sense is that this is a tremendous benefit, not just to tenants, but to landlords who have been complaining, and rightfully so, that they would like rent money. So I'm hopeful that this would be a good way to bridge some of that gap between the parties.
Yeah, thanks for unmuting me. We have been fighting for rental assistance forever. So we don't like a moratorium, we like rental assistance. So this is a good step, a step in the right direction. First of all, Jeremy, I think we heard yesterday that Travis County opted out.
Yes.
So there's another $100,000 for us.
Correct. It'll be 600,000. Yes.
600,000 for Harris County, which frankly is not a lot of money for what we saw, especially in the first tranche of 15 million that City of Houston, got rid of in 90 minutes. So we don't know how long this is going to last. So what we like about the program is it's 6 months with Donna's. I think that's great, and it goes backward and forward, kind of going towards the idea that that it won't be settling this debt only to create another debt next month. So hopefully the going forward part is effective in that. Obviously, we've also been fighting for getting it as early as possible, as I think Curtis said before, and this is not early. This is after the eviction's been filed, after the delinquency's already there, and after you wait for your court date and then get a court date. So that's an issue, but I understand that the state is working on
with the $171 million, this is only about 10% of that money. And so the state is working on another rental assistance program that I don't think is going to be as court supervised, but we don't have any details there. Also to bolster what Donna said, so October 12th, Monday, is when the pilot program begins for I guess it's now 19 counties. The Supreme Court order says November 9th is when it opens up to all counties. We heard yesterday that on a webinar that with the OCA that apparently is not going to be the case. It's going to extend. November 9th is too early for them, I think. So maybe later November, maybe even to early December is when it'll open up to all the counties. So we'll see. The requirements look fine. Eligibility requirements, certification requirements look good on paper. So let's see what happens. It's a pilot program, so be patient, and we'll work out whatever issues we need to work out.
And Howard, to your point about it not being earlier, one of the things that they're trying to work out is that federal waivers, because of the federal requirements of emergency rental assistance and ESG money, is that it has to be imminent eviction. So it's always the notice vacate qualifies as imminent. And so part of this process are the barriers that are attached with those federal funding. And quite frankly, one of the barriers is that because imminent, it's not upstream, it's never upstream, just because of the federal qualifications. So these are the things that they're looking to weigh as they move forward and trying to implement the full program.
I think that there was a question in the chat asking how the different counties were picked. And my understanding is, and I've been removed from that process, but my understanding is that the state had an interest in trying to hit the metropolitan areas with the greatest number of evictions, really trying to meet the need of the diversion of a great number of people, and maybe kind of nodding at what the CDC was contemplating in its order is to avoid homelessness in the state. If Stephen made mention of the local NPR story that was local, and I understand will be going nationwide, drawing even more attention to City of Houston and to Harris County. The only spot that Lone Star Legal Aid has in this and other eviction defense legal service providers is our goal in trying to raise the rate that defendants have representation in courts. You all see me asking in these meetings of Jeff every time he presents his data that we like to know how many tenants are represented, and that number seems to always be rather low. But we are happy to represent tenants, and we're hopeful that with the state's recognition and actually putting some money into legal services with this diversion program, that more tenants will find assistance and will actually be routed towards legal services, not just in Houston, but throughout the state.
And there's no coincidence that they're implementing this program less than 30 days before the election. Absolutely not.
Correct. And thank you, Judge. And thank you, Howard, too, for your perspective.
Okay, so let's move on to Jeff. Nice segue, Donna, to introduce Jeff to present on his data.
All right. Well, thank you, everybody. I'm feeling really chatty today. In the chat, so let me just pull up my, everybody can see my screen. Looks okay. I'll take that as a yes. Basically what we're seeing, we're about a month out from the CDC moratorium that took effect on September 4th. What we're seeing is that there's a couple of different ways to look at this data. Now I show you this picture every month. The dotted line is a 30-day trailing indicator. So it kind of shows you the 30-day trends. This chart begins in January of 2020 and it ends current day. You can see that somewhere in June, eviction case filing stayed very steady. What we're seeing is the potential for a very slight drop in cases since September 4th. So you're seeing again, like a 30-day moving average going down, but the slope at which it's going down is relatively minor. I would say an appropriate way to classify this is that evictions are holding steady with a minor drop, which might indicate a future decrease in cases filed. What's important now, though, is since this pandemic, we can really start to see that there have been lots of different measures that have been employed that have different expiration dates, all of which have been forces to keep eviction case filings lower. Those forces include, as we can see in this gap here in April, the statewide moratorium on evictions, where cases filed went down considerably, as well as the beginning of the pandemic and many landlords working proactively with their tenants to extend a lifeline. But then we also have various rental assistance programs, stimulus checks, unemployment benefits throughout the summer. And then now we have, as we started to see that remaining steady, we have a CDC eviction moratorium. Much of the press wants to look at individual interventions and say, is this causing or is this preventing? What effect does this have? And I think the really important thing that we're all getting to the meat of now is that it's really complex. There's a lot of things that are going into preventing evictions, and eviction case filings are just one metric that we can use. I'm really excited to see the output of all the different working groups and the data at which they're focusing on, because things like rent, things like vacancy, all of those things are going to have an impact on them. And certainly understanding these state level diversion programs are phenomenal and have the potential to move this metric in the right direction. So generally speaking, the month out update is that eviction activity is pretty steady, although we are seeing a slight drop. That drop could be due to the moratorium. It could be due to seasonal factors. That's my report. Oh, and to Donna's point, just because she brought it up, allow me to show you the dashboard. And since the moratorium on that took effect September 4th through today, within Harris County, only 1.49% of defendants have been assisted by attorneys, and we've seen just over 2,000 cases filed. Does anybody have any questions? All right, well then, if anybody does have any questions, feel free to email me.
Looks like Zoe has a question, so I'm unmuting you now, Zoe.
Hi everyone, sorry for being late. So your dashboard shows evictions filed, not cases heard. Do you have the breakdown between cases? Because I know there's a difference in, like, some judges are scheduling differently, some people have really high court volumes, that kind of thing. So do you have that? I mean, I can pull it too, but if you know that number, that would be interesting, I think.
There we go. I do, and in fact, something that I'm working on right now is a scraper for the docket information. And I was going to reach out to you as soon as it was done, because I know that you're on top of it, and hopefully I can make your job a little easier too. So we will have those numbers by the end of the day, and that is something that I think we should talk about, maybe adding to the dashboard as well.
Great, great answer.
Jeff, Chriselle's interested in having the stat read the number of tenants with legal representation re-mentioned or added to the chat, and then Curtis has a question, so I'm going to unmute him.
Sorry, I have a very loud keyboard, but I was putting that stat in there.
Hey, good morning. Jeff, just a question. You mentioned vacancies, and it prompted me about another issue that I was going to put forward to our group after we got some preliminary things resolved. Not to suggest that we should think about vacancies as musical chairs, but vacancies are an asset. And the question of whether or not there's some way is reasonable, and this would be as much a question to a landlord as it is to a data person, right? One is the information available to get some transparency to know whether it's a relevant number, that is the vacancy at any given time. And two, as an indicator, if a landlord were interested, would it make sense to consider putting their property into a pool for eligible, their vacant units, and for eligible units to get into those units quickly with some support and resources, if it's a proper match. So if I'm in a unit that's $1,200 a month and I really can only afford $800 a month, and there's a vacant apartment available for $800 a month, and the fund could help kick in, cover the cost of the security and all that kind of thing to get me into that apartment at $800 a month. Are the mechanisms there to support that kind of a market? That's kind of what I'm trying to look at. Is there enough slack in the system due to vacancies to accommodate some of the impact of evictions? Intuitively,
I think that's a really good question and a complex one. I can speak to the vacancy aspect of it. If we treat a rental ad listing on the internet as a proxy for a vacancy, which is an imperfect proxy, but one nonetheless. So an ad is posted. It's possible to be able to work with organizations like CoStar or just collecting it off the internet and providing alerts or helping a case manager provide that connection, I think, between the person who needs a place to live and that vacancy, especially if that vacancy is for less money. I think it's complex, but I know technically that it's possible. Whether or not that's feasible from a political or a legal or a, all parties involved standpoint, I would technically, how we would be able to deliver that information as quickly as possible.
Thank you. I wouldn't ask the question unless we had this kind of a multi-sectoral group, because I think there needs to be a gut check on all parties. That's something that's worth looking at, because I do understand it would be complex, but it might be, the things are a commodity anyway, right? Whether we like it or not. And so how to make it a more effective service. And so the question of shifting the focus to service might be facilitated through that kind of discussion to see if that's.
So Curtis, this Rick, I think that's an absolutely excellent idea and something that could in fact work very well, because if you look at Houston occupancy, okay, and we look at this a lot, obviously, since we all have properties here, occupancy is very low here, and which means vacancy is very high, and it's probably the highest in the country. And when you look at and that's primarily because not just COVID, because Houston was, out of my 14 markets in 9 states in the District of Columbia, Houston's the weakest market in America for Camden. And our vacancy is 200 to 300 basis points less in Houston in certain properties than it is across America. And so part of that issue, COVID added to it, but it was the oil and gas industry issues that happened in 2019 and oversupply that kind of hurt Houston. But if you think about what the Way Home program that we implemented for the homeless program, when under Mayor Parker, we delivered 2,500 to 3,000 new housing units, and those housing units were all connected to the Way Home program. So when we had a homeless person that qualified for supportive services, we immediately knew where they were going to go. They were set up to go into that apartment once we found them, and once we had the apartment. And so, I think it's an amazing opportunity. The key is going to be, how do we coalesce a group around recruiting landlords, and then also where's the money come from? Because it is about money. It's ultimately the Way Home program worked because we could we could fund those apartments with, funds that were available from HUD and other sources. So, I agree with you totally that vacancy is an asset, and we need to figure out how to turn that asset into housing for people that are most vulnerable. There's no question about that, and that would be an amazing thing to be able to do. And Houston, generally speaking, has had pretty low occupancy rates generally in terms compared to other parts of the country. So if we could somehow marshal that resource and then find the capital to fund it, you could house a lot of people that have lots of issues. No question.
Thanks, Rick.
Mm-hmm.
Thanks, Jeff. We'll follow it up in our group, but I think yeah, I'll follow up with you, Jeff, through our group.
Awesome. Looking forward to it. And just to speak to Donna's question, capturing the number of abatements, I'm not sure, but I'll take that on as homework and report back to you as soon as possible.
Great, and now I'll turn it to Martha to introduce the next topic.
I'm pleased to introduce Anna Rouse and Jessica Preheim this morning. They are from the Coalition for the Homeless, which also has a funded eviction prevention program. It will be interesting to hear about the difference in focus of these two from the earlier program, the courts program. Anna's been with the Coalition for the Homeless for many years and has overseen their work on the ground as a program director. And Jessica works to move their advocacy efforts and outreach efforts forward. So I will let you both take it away.
Good morning, everyone. So do you want me to share my screen, or do you want to share?
Anna, it's your preference. I'm happy to share it if you would prefer. If you want to, you have the ability to.
Okay, I'll just go ahead and share then. Let me see. Hang on, let me move my slides over now. Can y'all see it okay? There it goes. Yes? Can you see my slides?
Yes, yes.
And I'm assuming Jess is on somewhere.
Yes, she is on. We're working to unmute her, so.
Okay, great. So I'm just going to quickly go over our community-wide COVID-19 housing program and some of the things that we're working on to try to target what we think might be an increase in our homeless numbers because of the COVID pandemic, but hopefully not. So prior to the pandemic hitting, we were in the middle of our strategic planning. It kind of started towards the end of 2019. We had Housing Innovations on board that's been helping us come up with the next 5-year strategy on how we can end homelessness in our community. We did that back in 2012 and we were able to end veteran homelessness and really start up our coordinated entry process. And so they took all of the data from our HMIS and kind of mapped out our entire system and looked at our inflow, looked at the number, our point in time count, and just really did a deep dive in our system. And this is what the pre-COVID housing need was. Over the years, we've targeted a lot of rapid rehousing and interventions towards families. And so inadvertently, we had caused kind of an increase in the number of single individuals experiencing homelessness. So it obviously showed in the number of units that were needed for singles. So you can see that rapid rehousing for singles were short about 1,600. Rapid rehousing for families were still short about 400. Permanent supportive housing for singles were short about 2,300. And then we were okay on permanent supportive housing for families. And for those of you that don't know, rapid rehousing is a short-term intervention for individuals that are newly homeless. It's rental assistance and light case management for a short period of time, depending on the household, to help people get back on their feet. And then permanent supportive housing is a permanent intervention for individuals that are extremely vulnerable, that have been homeless for many, many years, and that have a disabling condition that prevents them from working and living independently. So currently in our COC, our continuum of care, an individual has to be chronically homeless in order to access permanent supportive housing. So, then the pandemic hit, and so we're, in this actually a great time where we had all of these plans that we were putting in place. And then the pandemic hit and all of this CARES money was flowing into the community. And so the city and the county kind of reached out to the coalition to figure out how we can better serve our community, while at the same time kind of synthesizing our two plans to come up with some measures that will help support the 5-year strategic plan and kind of give us an edge on the strategies moving forward. And so on July the 1st, the City of Houston, Harris County, and the coalition announced a $65 million plan to house approximately 5,000 people over the next 2 years. Our premise is really that housing is healthcare, because we understand that our community's most marginalized and most vulnerable people are at the greatest risks of negative health and economic impacts because of the coronavirus. We know that people experiencing homelessness are twice as likely to get the virus, and if they get the virus, they're twice as likely to need extreme interventions and possibly even die. So we really wanted to make sure that we were targeting all of these individuals, and we knew that there were going to be immediate resources needed to house this much vulnerable population, because we all benefit, right, when we prioritize the needs of the lowest income and most marginalized people in our community. I don't have to tell all of you that. But that includes people experiencing homelessness, because we don't want them to get sick. We also don't want them to spread the virus to other vulnerable populations. So the proposed 2-year strategy is listed in front of you. And this is really, sorry, let me move my thing over. This is really, the top 3 are like the bulk of how we're going to target all of these individuals. The bridge to permanent supportive housing is really a bridge to permanent supportive housing for those individuals that are currently waiting on our wait list for that permanent supportive housing intervention. So we have about 5,000 slots of permanent supportive housing that turn over in our continuum of care at about a 12% rate. It's a little bit lower now, but it's about 40 to 50 through natural attrition. And so right now, an individual has to wait on our wait list, and they're still on the streets, they're still in an emergency shelter. And then when a slot comes available, the next vulnerable person, highest vulnerable person, is referred to that slot. But they have to work with the navigator to get off the streets and do all those things. Well, with this CARES treasury, the ESG and the CDBG that came into our community, we're actually able to use the rapid rehousing as a bridge to permanent supportive housing. So what that means is that we're able to house people immediately, those very vulnerable people, and put them in an apartment, a market rate unit, right away, while they are waiting on that PSH slot to turn over. So we plan on doing that for about 1,000 people, and then turn them over into a PSH slot, which is a permanent subsidy, over the next 2 years. The 12-month rapid rehousing is really targeting about 1,700 individuals that are newly homeless due to the pandemic. Maybe they lost their job because of the COVID-19 virus, or maybe they got sick. Whatever that reason is, we have written those questions into our coordinated entry process so that we can better understand individuals that are experiencing homelessness because of the pandemic. Diversion is something I'm going to talk a little bit more about, but it's brand new, and this is where it ties in closely to what this group is doing. It's really about case management that's focused on conflict mediation, and it's a rapid resolution to prevent people from entering our homelessness response system. The other 4 things are kind of like enhancements towards the top 3. So the auxiliary sheltering, we've already done that. We helped set up an auxiliary shelter for so that our existing shelters can have space for social distancing. We actually moved people from our existing shelters into an auxiliary location so that the people in the shelters could stay safe. Additionally, there was an increase in domestic violence cases because of the pandemic, and so we were able to get some funding for our domestic violence partners to have hotel rooms for individuals that are domestic violence survivors and needed that intervention. The mental health case management is a pilot that we're trying out. We're actually really excited about it. Over the years, we've learned our lesson when it comes to housing individuals that have been experiencing trauma related to homelessness for so many years. Once they're in housing, they kind of decompensate And there are some behaviors that might lead to evictions or lease violations. And so this mental health case management pilot is funded through Harris County, and it's a partnership with the Harris Center. So we have a team of individuals that are dedicated to CHIPs. So people that we house through the CHIP plan that are in that group that need that mental health intervention will be connected to this group so that they can work with them to maintain their access to care, which will ultimately lead to lessening those lease violations so that they can stay housed. Enhanced street outreach, we're also very excited about. It's something we don't have enough outreach teams in our community, and we definitely haven't had enough outreach for the unincorporated areas of Harris County. And so we heard our commissioners and we heard their staff as well as their constituents and the partners out in those areas that, you know, homelessness has kind of gone out a little bit into the suburbs. And so the coalition now has 2 outreach teams, and they just started in the last month actually, going out to the unincorporated areas of Harris County and all the areas where our existing outreach teams don't cover, so that we can make sure all of the individuals in those areas are assessed and put in our pipeline for housing. And then lastly, we have this, you know, PSH housing preservation, which is really for individuals that we put in permanent housing that we need to help maintain that housing. And so with diversion, it's really looking a little bit deeper into it. It's really a strategy that prevents homelessness for people seeking shelter. So one of the things that we get scored on when we reapply for the $42 million in homeless service funding that comes directly from the U.S. Department of Housing and Urban Development through the continuum of care process, we get scored on the number of first-time homeless and people returning to homelessness through our homeless management information system. So if we have an increase in those 2 things, then it impacts our score on the NOFA application, which can then impact the amount of funding that comes into our COC. So one of the things that we were looking at when we were planning our 5-year strategic planning is that inflow that happens into the homelessness response system. So a lot of that can be at either the shelter front door, someone is actually seeking shelter at the front door, or someone is calling an intake line because they feel like they can't go back to their unit for whatever reason. Maybe they have a lockout, or maybe they've had conflict with family members they were living in, and there's not enough resources to feed everyone that's there, or, you know, pay the utility bills, whatever that may be, and so they seek shelter right away. That's where we're targeting our diversion. So when you're looking at diversion versus homelessness prevention versus rapid rehousing, it gets really confusing. So it's really about, the services are very similar across all 3 interventions. Housing, homelessness prevention is really about an imminent risk. So it's individuals that are precariously housed, but they're not yet homeless. Rapid rehousing is for people that are already homeless, they're already in a shelter, or they're living on the streets. Diversion is really about those individuals that are requesting assistance at the front door, or another program or system entry point, and seeking a place to stay. So our TA providers shared this document with us, and it's really, let's see if it'll let me open it. It may not. I can send this out to the group, but it's really, really great. It's a document that shares, you know, designing these successful programs, eviction prevention, homelessness prevention, and diversion, really about what the strategic focus is, and what the target population is. So like the eviction prevention that we've been talking about a lot is really about like that community threat. So those individuals that have maybe never been homeless before, near or at the poverty line, and really just we're working as a community to prevent homelessness for these people, to prevent eviction. And so that's what, you know, all of this eviction prevention dollars that's running into our communities are looking at. Homelessness prevention is a little bit more than the one time. It can be for a few months to kind of get somebody, you know, back on their feet. And then really for diversion, it's for people that are actually seeking assistance for shelter. We had a work group that met for about 2 to 3 months to come up with an initial pilot to figure out how we're going to do this intervention. And there are 4 agencies that have been funded for diversion in our COC, and we're hoping to start that piece of the CHIP plan towards the end of the month. So currently it's going to be Baker Ripley, Northwest Assistance Ministries, Salvation Army, and I know Endeavors. So Endeavors is brand new to our COC, but they've done a lot of veteran assistance, rapid rehousing, and SSVF. in San Antonio. So we actually just met and we talked about this initial workflow that we've set up in our HMIS. So there's really not been an exact method identified that's a good predictor on if someone will become homeless or not. But all of the things that we've read about, we really look at, it shows that people that have had one or more episode of homelessness and are needing diversion or eviction prevention are greater likelihood to become homeless if they don't get that intervention. So we pulled data from our HMIS to see how many people we believe self-resolve, and we kind of define that as households that only had one intervention in HMIS, and it was more than likely homelessness prevention, and never came back. So over the period of time, we found there were about 38% of the households in that data range. So we wanted to leave those individuals alone and then focus on those households that might have had one or more episodes of homelessness in the past. So when you're looking at the workflow, if someone is already homeless, then they're going to go through the regular coordinated entry process and get assessed for housing. Depending on if they're chronically homeless or not, they get rapid housing or PSH, and then they get placed on the wait list. Eventually, they'll be referred through the CHIP plan. But then if someone is not homeless, then the next question is, where are you staying tonight? And if they can't return to their place tonight, or if they can return but they have to leave in like a few days, maybe 4 or 5 days, then that initiates that diversion referral. And so a diversion conversation happens with the trained diversion case manager. So what we're looking at right now, and understand that this is new, so we're piloting this right now. So as we start doing it towards the end of the month, it may mean that we're doing it all wrong. And so we have to switch it all up and try to figure out a different way. But it's really been interesting being a part of this group because I'm learning so much about eviction prevention that I've kind of shared with that work group. And so as we're having that diversion conversation, it's about, creative solutions. So let's say, my family lives in Dallas and I just need a bus ticket to get back to my family member because that's where my support system is. If we can confirm that there's someone on that end that can truly, receive that individual and will be their support system, then diversion funds will pay for a bus ticket to that family. Or if it's someone that, has a lockout on their door and just can't go back, then we would have conversations with the landlord to see what we can negotiate to allow that person to come back, understanding that there would be a financial assistance payment at some point. Or maybe it's a family member that, has gotten into a disagreement with each other. Maybe I live with my mom and I lost my job, so I can't help support the household anymore. I was paying the light bill and now I can't pay the light bill anymore. So my mom says I can't stay there. Diversion could maybe pay for, a few months of an electric bill so that the household would allow me to come back. My mom would allow me to come back. So it's really, there's a lot of conflict mediation involved. We're looking at some great training programs to train up our case managers because it's a little bit of a shift in mindset. We don't want it to automatically be a financial assistance payment. We want there to be more conversations to see if there's something else that can be done before we resort to financial assistance. So it's a huge risk versus reward thing with this CHIP plan. It is a massive surge. We have new partners. There's a lot of scrutiny. The city and the county, there's a lot of players involved. We still have about a $6 million funding gap. We've raised close to $2 million, and there's about $3.5 million in asks out right now. But it's great. We're going to house so many people, and there's a potential of ending chronic homelessness, which means that those permanent supportive housing slots can be opened up for individuals that are not yet chronically homeless by the definition, but still need that PSH intervention. They can go into those slots, which means we'd be one of the first largest city in the nation to end chronic homelessness. There's been a lot of people hired for this, so we're very, very excited. And then I'm going to let Jessica talk about this other thing that we've learned since Housing for Harvey that has been very successful in a lot of the programs that we've administered. Go ahead, Jess.
Yeah, can you guys hear me okay?
Yes.
Can you? Okay, great. Sorry, having some audio issues today. Yeah, so we have used what we call a landlord incentive fee. We started this in our homeless system during Housing for Harvey. So this was really our system's approach to getting people out of the shelters after Harvey, and really doing a non-congregate shelter approach, which was funded by FEMA in partnership with private donations. And during that time, we knew that we needed to get people into a stable living environment as quickly as possible. And one of the tools that we used to do that was what we called a Landlord Engagement Fee. And on our team for this CHIP program, we actually have a landlord engagement team as well. So we have 3 full-time staff where this is all they do. They really work with landlords. They work with the apartment association. They work with social serve. They work with case management partners. Sometimes they work with clients, depending on what it is. But one of the main features is that we pay in lieu of a deposit. We approach landlords and say, can you please waive all your application fees, all of your deposits? We will pay a one-time, almost, we call it our incentive fee. And then we ask for a few things in return. Because this is not a deposit, this stays with the property owner. Which is an incentive for many property owners. So this can help them get their unit so that it passes inspection, that it's maintain quality. It's also a little bit of an assurance as we are working with homeless individuals, and sometimes there is hesitation to accept them as tenants, people who have experienced homelessness. So this is also kind of an incentive fee for the landlord. But in return, there's many benefits for the folks that we serve who are exiting homelessness. The landlord agrees to waive many of their criminal background requirements. We know that people who are experiencing homelessness are, there's a lot of inequalities in the justice system that affect their ability to lease up a quality unit. So they make exceptions for criminal backgrounds. They also make exceptions for things like a eviction history, credit history, waive fees, and they also agree to do the application process very quickly. So sometimes, it may take, a week to get through an application process. The landlords return the criminal backgrounds, they return the application, approve within 24 hours. They also make sure that the unit will pass any quality standards that are associated with the use of federal funding. And so we really found this to be a valuable tool. And in fact, after we've shared this with HUD, with some of the recent CARES dollars that have come through, HUD has actually implemented this as an allowable practice across the nation, which is something that never happened before. So we've really, it's been catching on in other areas, especially areas that have a very tight housing market. This incentive fee has been able to open up units and access to folks who have had a challenging time securing permanent housing. Next slide. Again, there's a lot on here. I think I covered most of it. But one thing too is that the property owners also agree to work with case management. When we're housing folks that have multiple barriers, who have had long time experiences with homelessness, we really want to set folks up for success. So it's not only a roof over your head, it's a home, it's furnished, and it's paired with a subsidy in case management to help people overcome their homelessness and exit homelessness for good. And so the property managers also agree to work with case managers should there be any tenant issues that come up, and really try to, instead of just going straight for eviction, really take a look, a joint collaborative look at the housing stability practices of their property to make sure that they do, to the most extent possible, keep people in those units. Anna, do you have anything else to add here? All right. We did go through this already, but this is just a breakdown of the $65 million that was committed by the city and the county. The city of Houston put in $40 million, Harris County $18 million. This is really paired with the $8 million. We are paying these landlord incentive fees out of private dollars. This, again, when funding was announced, this was not an eligible activity. It was much more of the traditional deposit structure. And so we are using private philanthropic resources to be able to be more flexible in how we approach this and to move very quickly as a community. We still have some money to raise, but we are underway. We actually have requests under review, or almost up to, I believe, $3.8 million. So we hope to hear some good news soon. but we are starting now. Next slide.
Yeah, so the next slides just basically cover the program implementation and support structure. The coalition is going to be project managing this the entire 2 years. We have some TA support, but we have some senior staff on board that's kind of guiding this. And then the leadership team is really made up of city, county, funders. And then, you know, we've been on target so far. We hope to house the first few people this month. There's been a lot of contracts that have gone through City Council and Commissioners Court. We have a very aggressive targets for this 5-year plan. Hopefully in 6 months, we'll have targeted 1,400 people and then the 5,000 at the end of 2 years. So that is all that we have. If y'all have any questions?
There are a number of questions in the chat, starting with, and I'll go back, Diana Zarzuelo has asked a little bit more information about the intake and entry process. I think this was the slide that you addressed on centralized access. And I think as I read the question is, you know, she asks, is it literally someone knocking at the door? But what might be the way to get into that initial conversation of where did you stay last night?
Yeah, so we are actually in the process of working with 211. So right now we have all of our coordinated access hubs located throughout the continuum of care. So all of the shelters are coordinated access hubs, Northwest Assistance Ministries, ACE Foundation Houston, Career and Recovery, Beacon are some drop-in locations. And then of course, all of our outreach teams are trained to do assessments in the field for people that are unsheltered. We knew that there's one thing that is missing right now, which is a call-in line. We used to have one a few years ago, but it went away because of the funding. And so we are actually trying right now to work with 211. We did get some funding for a coordinated access assessor position. And so what we're going to do is we're going to hire that individual who's then going to embed themselves at the 211 office. And we've met with them. And so right now, tentatively, what we're going to do is someone will call 211, and we're working through some screening questions. So if the person is homeless, for example, they'll be routed to that assessor right away so they can be assessed over the phone. And so what we're working through right now is kind of figuring out what that differentiation, what that line is for eviction prevention and diversion. So again, it's looking like maybe it'll be that conversation about where are you staying tonight and how immediate that need to leave is. And that's what's going to determine if the person is going to get, get referred to, Baker Ripley, the city or the county eviction prevention or the state now, or if it's going to go over to us for diversion referral. And so then the referral would go to one of those 4 agencies that have case management staff and financial assistance for diversion. So that's what it's looking like right now.
Okay. Chriselle wanted to know a little bit more about, you gave great examples when you were discussing the people who might be going through this process. Can you explain or give an example for enrollment and workflow diversion and administer services?
So, enrollment is a technical term that we use for HMIS. So enrollment means that the person is enrolled in that diversion program in our HMIS system, which let's say it's Baker Ripley. So then Baker Ripley is going to have a Baker Ripley CHIP diversion program. And when the diversion referral goes over to Baker Ripley talks to the individual, gets some further information. If the individual meets the criteria that we've talked about for diversion, they'll get enrolled into the project in HMIS, and then the Baker Ripley will provide the assistance. So that's what administer services means. They'll actually provide the assistance for that individual. It won't be the coalition that's providing the assistance. It's those organizations that's providing the assistance.
And just some background, HMIS is the Homeless Information Management System. It is actually a database that's required by HUD. And so HUD issues different specifications, and it's a requirement for ESG funding as well as continuum of care funding. So because of the funding we're using for CHIP, this virtual enrollment is a requirement, but the enrollment process is in a database, but the case management then is paired through the system to really support that family into stability.
Yeah. And then the coalition is really responsible for all the reporting out to HUD and to all the federal dollars that are being spent for the CARES funding that came into the community.
So this is really the program triaging is going to be somewhat dependent on whether a family is already enrolled in HMIS for previous surgery.
No. No, it can be somebody who's never been in HMIS before. They'll start the conversation with, you know, where did you stay last night, and then go from there. It can be people that have never been in HMIS before, even if they, you know, as long as they meet that distinction of needing to leave immediately or in the next few days from wherever they're living. That's what's going to determine if they get diversion. So it doesn't matter if they've never been in HMIS. At this step right here, they'll be entered into HMIS.
Curtis asked a question about the landlord registry, and if you have an average number of units per landlord in that database.
So we do not at this point in time, since we're kicking this off, but our manager of landlord engagement has been working with the apartment association and social serve. She has reached out and she has been targeting landlords that have that are kind of the medium-sized property, as well as have vacancies that are you know, somewhere above 10%. What we do then is try to kind of get economy of scale. Can we have, you know, can we go out, can we do inspections, do kind of a walkthrough to make sure this is a quality unit? We're looking at mapping them all over town. But we do not have that actual database built out yet, but it is something that we hope to create as we continue to implement this project.
If there are landlords that are interested, we do have on the website, we do have a link where landlords can make can do an inquiry if they're interested in participating in the program. It's on our homelesshouston.org/CCHP website.
And what is social serve?
Social
serve is,
yeah, go ahead, Jess.
Social serve is an apartment search database that is a little more robust than the general databases that we find. It is in Harris County invests as well as actually the Houston Housing Authority in allowing for access to this database. And what Social Serve, it's really the platform for this search engine, but they have worked with us to allow us to do customizable back-end searches for units. So maybe we can go in and do a much more tailored search. Maybe we know someone has an eviction history. We can look up and say, hey, you know, are you a property owner that, you know, that accepts, you know, subsidy and has more relaxed criteria for eviction? So we can target our searches for the clients that we are attempting to house. So it's really a platform. It is across the nation, but we use it here locally, again, funded by Harris County and the Houston Housing Authority in combination for our access.
Okay. I think I've addressed all the questions that came up in the chat. Are there others? Okay, I will turn it back to Stephen.
So I think what we're going to do is we've decided to call a little bit of an audible here and take a risk and try something. Given how robust the conversations have been, we're going to try to do a large group discussion following up on the presentation. Having said that, we're going to sort of come back to it in 5 minutes just because Cynthia has a time constraint and she's going to need to drop off early. So I'll ask Cynthia to maybe to give us an update on the direct assistance program that Catholic Charities is running on behalf of the county. And then when she's through, Martha will lead the group through a discussion based on the really excellent work that the coalition's done and the fantastic presentation from Anna and Jessica. So Cynthia, let me turn it over to you, please.
Hi, everyone. I'm not in San Francisco. I'm at my humble house in Humble, Texas. But I figured this was a better look overall than my blank wall. So join me at the San Francisco Golden Gate Bridge. So, you know, we've really been in operation 8 days, 8 business days. So I just want to remind everybody of that, although we're learning things. We had a distributing direct assistance. When we received the calls, or the number of people to call, we had about a 40% response rate. And so we knew we had to make a lot of calls in order to get the number of applications to spend down the funding. In this case, I would say our response rate is lower than what we projected. So let me just run some numbers by you, and then I think I'll have a better, I could do some a visual report as well next week. So first of all, we're partnering with Connective, as most of you know. They have sent out in 2 different waves. They've reached out to 19,863 applicants. We have in turn then contacted by phone 8,769 of those, which is averaging just over 1,000 a day. That's 44%. Now the second wave, so it's, if you think about it in half and half, the second group of clients were contacted, I believe, Monday or Tuesday of this week. So it's not that all 19,000 were contacted for the full 8 days. Of the 8,769 calls that were made, and not all clients are able to be reached. Some have been disconnected, some are not interested, some hung up on us like this is a scam. That's a few of those. Some have, we've left messages and we'll keep trying. So out of those 8,769 phone calls to follow up, you know, we've reached, that represents 44% of the 19,000. But again, we just got the second batch of clients on, I believe it was Monday. Of the 8,769 calls, that's yielded 3,305 applications. Of the 3,305 applications, 260 were deemed not eligible for whatever reason, maybe their income or etc. So of those then, that's only 7.8%. Of those then, we have 3,045 applications in process, representing 3.6 million. Of that, it's either been in process, meaning that it's the clients are gathering the documents to submit. We've either paid them or pledged. So, you know, we have a response team that's taking calls out of concern. So if a client issues a concern, we call them back. And the majority of those calls are really people wanting to apply. They've heard about it from someplace and they want to apply. A few maybe had trouble submitting their documents or submitted the wrong thing. So that's taking some time. I think the issue is going to be, and think about it, do you remember exactly what you did in June? I don't. You know, we've been so busy and life is what it is. So I think calling people is probably taking the most time to connect with them and explain what this is, and then start to get their documents. Some are not eligible anymore or not interested. Like we've had a few people say, thank you, but I just don't need the assistance right now. But clearly we need to generate more calls. So it's definitely, we've got to ramp up our call rate to over, you know, probably 2,000 to 3,000 a day in order to generate the number of applications. And I do think that once we open up the application for new applicants, we will definitely see a lot of people who are eligible for the program. So, you know, only 8 days, 7 of which, the first day was all contacting clients by Connective. We got the information and started calls on the 1st of October. So more to do. I mean, we're not anywhere close. If you think 40 million minus 3.6, what do we have left? 46.4. No, 36.4 to go. So we're on our way. Martha, I would rather, if it's okay with you, I'll send you an email and then you can, or somebody, Stephen, I'll get it to you and you could send it out. How about that? I'm on my phone right now, and so typing into chat takes a bit. And by next week, I'll be able to provide a PowerPoint page, which will explain where we are. Questions, comments? I know it's going to take more calls to yield more applications. And I don't have it by precinct today. Hopefully by next week, I'll be able to provide that. How many, applications by precinct?
Okay, thank you very much, Cynthia. I don't know, Renee, not yet.
I mean, I thought we were just going to go into the presentation, but.
Okay, I'll get off then. I apologize. I have another meeting at 11:30. And if I could be on the agenda for maybe 10 minutes next week, we'll make sure that we have a PowerPoint that shows the numbers and I can share that. Okay? All right. Thanks, Martha.
Thank you. Take care.
Okay, Martha, are you going or we want Renee to present?
I'm deferring to you.
Okay. All right. So Renee, how about it? As long as you're teed up, you can go. All right, hold on, Renee. We need to unmute you.
How about now? Can you hear me?
Yep, great.
All right. Well, good morning, everyone. So here are our numbers. This is as of this morning. So the first numbers you'll see there is the total number of landlord locations that are participating in the program. We have 13,674. Of those, which is an interesting number, and we were tracking this, of those, almost a little more than half actually have tenant applications tied to those locations. So we received a lot of interest from landlords whose tenants have not yet applied. So we're reaching out to those landlords and letting them know that funding's still available and to get the word out to their tenants. The 13,674 landlord locations represents 6,585 companies. So there are some companies that have multiple locations. And as you can see, the average is about 2 locations per company or per owner. So that's on the landlord side. On the tenant side, to date, we have received 43,861 tenant applications. Some of those have dropped out. Nearly 10,000 applications have been eliminated. Some were eliminated because they were duplicate applications that tenants submitted. Others were eliminated because they were not eligible for the program, either because of their income or other reasons. And some were eliminated because they didn't owe rent. They were applying for future rents or for trying to get assistance of a different nature. So as of right now, we have of the 43,000 applications that we received, 31,000 have been selected for processing. And of those 31,000 that have been selected for processing, 10,536 have already been paid. So they've gone to the finish line. In terms of dollars, the 43,000 applications represent $61.4 million in assistance requested. When we filter for both the tenants' applications that were removed, as well as once we factor in for the maximum amount of rent that could be paid through the program, the total amount that we have selected for processing is $44.5 million. So we still have 15.5 million available, and we're still getting the word out to both landlords and tenants that we are still accepting those applications. And finally, the 10,000 tenants that we have paid for has been $12.5 million in payments out to landlords. Last week, we almost got to $3 million in payments. We're hoping that this coming Tuesday will be over $3 million, hopefully closer to $4 million payment. So things are really picking up in terms of payments. And that's it for my report, just keeping it simple today. So if there's any questions, happy to address them.
Oh, thank you, Renee. It's good to get the updates as to what's going out on the ground. As Stephen said, we're going to change our model a little bit this morning and go into some general conversation with each other. And we've heard from both the court system and now from the Coalition for the Homeless about attempts to lessen the impact of potential evictions and to open up opportunities for continued housing. One of the hallmarks of the work of this task force has really been bringing groups together that historically haven't worked before in a much more complementary and actually with some pretty high engagement. We've had that example with the court system and with the rent assistance providers. I know that rent assistance providers on the ground have been provided training in the eviction process and what it actually takes to create that. And so the question that we'd like you all to discuss is, and it's in the chat for your reading as well, how can the task force or individual organizations leverage the work of the Coalition for the Homeless, as well as the State Diversion program, to avoid displacement and achieve housing stability, especially for when the CDC order expires? So what is it really going to take as a broader community to make those programs work most effectively? So if you could either indicate in the chat or by raising your hand, you are allowed to unmute yourselves, but I will call on people as you have this discussion. Anna, what is it going to take for the coalition to do this? What are you going to need from local providers or from this task force to make this work?
I think I think the thing that we're most worried about right now is training for case managers, for staff that are going to be talking to people. So if anyone knows of some robust training programs or can point us and has some suggestions on how we can train staff to better have these conversations, this conflict mediation conversations with people, that would be great.
And Chriselle, you talked a little while ago about the very low percentage of people who know about any of the programs. Do you have any thoughts about how to get the word out to people so they would know to call 211?
Yeah, I think that, and I know that we keep saying we're going to get together and talk more about this, but I feel like it needs to be like a concerted effort or a conversation specifically with those organizations that are directly interfacing with real people to get a sense of that. I think, part of this group, we definitely have people that represent the interests, but I think we need to, identify who is actually picking up the phone and are having ongoing conversations person to person to determine that. Because we know, and Celeste, I'm not sure, I think she's on the line. I know she shared several, a few weeks ago that even with them, with TOP calling over 200 people, only at that point in time, only 20 people even knew that there was a CDC moratorium not moratorium, but the CDC order in place. But I'm unsure as to even of the 20, if they knew how to navigate that or how to even get, to even just dial 211. So I just feel like there still needs to be a direct conversation with impacted people and not necessarily those who represent the interests of impacted people.
Yeah, Chriselle, if I could follow up on that. We partnered with a few city council members last weekend as well as some other community groups. And we canvassed for 4 days. And the feedback that we got, we didn't actually talk to a single person. And we were focusing on areas, buildings with high eviction rates. Basically, we were going and dropping off a document that had kind of an overview of the protections on the front, and then the CDC moratorium on the back. And and I think that Celeste can follow this up. Like we didn't meet a single person through that canvas who knew about the eviction moratorium. And we did come across several people who were in the process of being evicted. One person who had actually already been evicted, but they hadn't been removed from their property yet. And all of the people that we talked to were covered by the order. So I think that Chriselle is 100% right. It's the word is not getting out. People don't know about the moratorium, and a lot of people that should be covered are not being protected. And a lot of landlords are also not following the guidance of the Supreme Court, the order of the Supreme Court, because we had several people who said that they hadn't gotten any information from their landlord about the declaration, as was ordered by the Supreme Court.
Celeste, do you want to share what you put in the chat? Because I was going to say something, but it would take us a little away from this, and I think this is a valuable, like, the lessons from the canvas are valuable.
I can. I'm in the traveling out of town with my toddler, so I can't promise it's going to be quiet. But yeah, I mean, I think that, like, I don't know how possible it is to synthesize all of these programs and, like, eligibility requirements, and then, like, you know, links and numbers to, you know, give to people, on how to access all of these funds and programs and housing, right? Because we're limited in our ability for how to talk about it, because we just, you know, we're talking about the City of Houston program right now and the county program. That's all I feel qualified to talk about, but it would be great if there was, you know, multiple one-pagers, and maybe there are already, and I just, you know, I haven't had a moment to look around for them, but if people have that kind of stuff that we can leaflet with, that would be really helpful, because we're gaining volunteers each week. So we have large groups. I think we're going to start hitting multiple complexes each Tuesday and Saturday, because we have a lot of people who are really interested in, you know, volunteering, people who want to get out of the house and do something and feel like this is a good way to do that. So the more, you know, visuals, diagrams that help tenants, you know, navigate these processes and funds would be super, super helpful.
And I would quibble with that just a little bit. I think short term it's helpful, and I understand the point for sure. But what I think about larger is systems that are more intuitive, and that are more collectively collaborative. And the example that I give here is you know, talking about social serve, and we could at a different time, you know, have a longer conversation about it. But conceptually, that product or some other product, you know, could be a one-stop shop for unit availability. And if everyone knew to use that one, then, you know, or whichever one, you know, a group of folks decided upon, the point is to have less systems that are more easily understood and accessible, than to try to wade through, in my mind, the confusion of having all of the different systems and opportunities we have, which obviously, again, we have to do now. And in the short term, finding ways to quickly try to pass that information on to folks who need it is obviously important. But you know, obviously there's tremendous inputs that they're getting, and wading through all of that is a challenge for them.
Be very careful. I totally agree, Mark.
I think one thing that I've experienced is that there is a lot of frustration and distrust with using 2-on-1 as an access point. And so I think that
that's something that we would have to tell people about, like how, I mean, when you show me the diagram, like, okay, this is like not 2-in-1 as usual necessarily. It's like very thought through. And so like, that is not the experience that a lot of people that we work with have. And so how do we make using 211 to access these services or get diversion help, like how do we make that appealing and like a trusted process? Because a lot of people have had, you know, drop-offs or, you know, people get lost in can or whatever, and that really reduces trust in the entry point to the system. So as much as we can, I don't know how we talk to people about that so that like they feel a little bit more held in the, or trusting in the process, but I think that that's something that popped in my head.
So is there sort of, I'm not disputing it. I'm just more wanting to hear a little bit more about what the nature of the potential distrust of 211 is and how widespread that sentiment is on the ground. I mean, I have, just FYI, I mean, I have, one of the things that we've been doing is monitoring the number of calls to 211, and it's substantially down from where it was in the spring. But I'm really curious to hear more about that.
So the primary complaint that I've heard from people that access services that are like they're routed to through 211, it seems to, the problem actually seems to lie in like the CAN system, which is like a case management like back-end system that I'm sure someone else on the call could describe much better. But you cannot, basically people feel like they're being dropped and the referrals are not kind of going all the way through. So if someone through like, you know, just being really busy leaves their case open with one agency, this is especially a post-Harvey example, and then they don't close out the case, like a person can't move around or the case can't move to another like immediate need that someone has. And I can send to, there was an op-ed that was written about it a couple of years ago, and anything people have been thinking about CAN a lot since then. But I can send that to give to the group to give some more background.
And if I may add, also to be clear, 211 is not specifically just for this particular issue. So it's like such a large array of issues that people can call in. Like I've had to call 211 before, and I'm still waiting on a response. And that call was made, and I sat on the phone waiting on hold for at least an hour, hour and a half. And that's because I have the time to do so. So it really it spans the gamut of like issues. And so we're trying to even talk about this one particular issue. So like there may be a process aligned, you know, for this particular, you know, when it comes to evictions and things like that, that may be streamlined, but it's in the like this whole mass of other information, you know, connections or junctures.
So once people get into a system and they're working within that, there's not as many complaints, but getting there is the challenge.
Getting there, and then if you have multiple needs, moving between getting those multiple needs met. Sometimes they're, you know, they're happening at the same time, and sometimes they, you know, are one after the other, and having one prior need that's not fully closed out can prevent accessing another service that you need, you know, as you move through the eviction process or displacement process.
Donna or Judge Brown, are there anything in particular that this group individually, collectively, in any way can do regarding the court-based eviction diversion program?
I think it's always been important, and you know, we've been doing as much outreach as we can. We continue to stress the point that CDC declarations are helpful to give them to the landlord. The Texas Supreme Court heightened that to a pleading requirement, meaning that in order to get the court's attention, it needs to be filed, and for many tenants, that's a big burden. we're here for that. You know, for people who qualify and are eligible, we're here for that. We've been working in a collaborative effort with 4 other providers so that we can meet the need that Guadalupe mentioned in an earlier chat comment now like an hour and a half ago about undocumented tenants. Whatever it takes to get the word out, we are more than happy to do the work and represent tenants, not only to get the CDC declaration filed with the court, but also to help them apply once we know what that application looks like for the eviction diversion program. Hopefully get them to bridge gaps with their landlord, with whatever mediation efforts if necessary, and if not, litigate the case. Hopefully we can avoid litigation if that's at all possible, but if not, I think if any places ever tenants have needed a lawyer, it's now. And if you all can help get the word out, I think that's what Lone Star Legal Aid has been hoping that this collaborative effort of the Housing Stability Task Force can help us help tenants.
So the Coalition for the Homeless has a capacity through all of its programs for 5,000 estimated individuals, and for eviction diversion itself for 2,000. How does that jibe with what, Donna, you might expect in the courts? What do you expect the caseload to be for the eviction diversion program pilot in Houston?
I don't know. That's a really great question, because I think that the eviction diversion program is going to be extremely strained by the very limited number of dollars that are available. My suspicion is that as soon as Houston Public Media or the Chronicle or KPRC or some big network runs this program on television or on the radio, as soon as people know that it's available, $600,000 are going to disappear in a week. This is going to be first come, first serve. And if people owe 6 months of back rent as opposed to future rent, it's going to go very quickly. I don't know how many tenants that would serve. Somebody would have to do the math on it. I don't think it's going to go very far. I think it's going to go very quickly.
I would say, I'm sorry, Don, go ahead.
I was going to say, I think it's going to look like the first tranche of rent relief. It's going to go in 90 minutes or something like that. I mean, there's just not a whole lot of money there.
I would say that that's only an initial amount. It's a piloted amount, right, for the program, and how it performs and how it does will dictate how the full amount, the statewide amount, will go out. It's kind of, Martha, to your question about the court. I think part of the discussion, this is, and I will use this as an example, talking with Mark from the Housing Authority, right? Knowing that a lot of his clients, I said, clients of the Housing Authority come through the eviction court, right? Either public housing or voucher-based program, right? And making a concerted effort to engage, the Housing Authority as a landlord to figure out what that looks like. How can we build better systems upstream than downstream? And so, as we know, like the money is not going to be an end-all be-all, just because in Texas and Houston and Harris County, we put money to these efforts, but we don't put a lot of money to these efforts. But the engagement piece, and how do we engage landlords? And I'm using Mark because, as Housing Authority, as a landlord, how do we engage landlords from a court perspective and looking at what the filings are, what it looks like, and how to, I guess, for lack of a better term, wrap around that landlord, that tenant with these services that are available more upstream. And it's different now because of COVID. Usually that engagement is going door to door. Usually that engagement is, meeting people where they are, right? But how do you meet people where they are, but at the same time maintain the safety of COVID? Because from we've done these eviction programs, and the best thing that we've done, particularly with Harris County Community Services, is having case managers at the court, So people can be met at the court, but it's hard to do that now in this COVID-related environment. Because and then you deal with people just don't trust these systems. People don't trust the court system, right? I barely trust it, and I'm a JP. And so you give people, we are putting these things on these citations, but quite frankly, people barely get that citation a few days before the actual hearing, right? And the person who's giving you a citation is a police officer, right? And then a person in a robe is telling you what to do. Hey, you need to be in these programs. That plays a lot into how people are engaged in these programs. So.
All right. Any sort of any other thoughts on this before we wrap up for today?
Just on a previous comment about the availability of money and how quickly that might get absorbed. I think if we think about the money as part of a system, and that we look at the money as a tool to leverage the system to address the problem. For example, for those who are working on mediation with tenants upstream, if there is a total indebtedness or arrearage that the tenant has, if the money is used to induce the landlord to make rent concessions, and if we understand that the landlord has some funds available or resources available through their vacancy reserves or other reserves, I think that there is not enough, there is some slack in the system, for lack of a better word, that these funds could be used to leverage. So it's not just paying the total indebtedness, but it's giving people some room to be willing to take some level of risk, whether it's the tenant to say, okay, I'll go into this agreement because I have some level of confidence that I'll have that income down the line, or it supports the landlord in saying, okay, I'll go into that agreement because I feel that there's some backup in case the tenant can't make the payment on time. There may be some way to stretch that money by using it to leverage the resources of others.
All right, so just again, by way of reminder, if anybody's got something that they really want to explore more in terms of some stuff that's happening on the ground that will help us all, just let us know and we'll build you into the agenda for the next meeting or two. And I will turn it over to Rick and Jeremy to wrap us up.
I want to thank everybody. This was a good conversation that we had, Stephen. It was good to have the full group talking to get everybody's perspective, and it was I appreciate everybody's honesty and respect of everybody's opinions, and really it proves why this task force is important. Just because everybody's heart is in trying to keep housing stable, right? And from the conversation, I can just, I felt that. And so I want to thank you all again for these frank conversations as we move forward.
Absolutely, I agree with everything that Jeremy said. I think that it is, I think, very special and important that we are, this group is together, because we do have a cast of characters that never really got together and talked about these issues. And I think that is really important for us to continue to understand each other and understand what the issue is, and then try to move it forward. I think the work that the small groups have put together and the focus there has been really good. And let's just keep pushing the ball forward and helping people, because I think that is the objective, obviously. Thanks.
All right. Thanks, everybody.